Chapter 6 takes us into a more specialized area involving adolescence, both in the family and outside of the family. And because of that, I have once again split this chapter's presentation into two different parts. The first part will be looking at abuse by and of adolescents within the family system, and is going to be the longer of the two presentations today. The second part will involve abuse of and by adolescents involving individuals outside the immediate family system, and this would include dating, violence, and those kinds of things. And so this is a particularly interesting chapter, and it's not something that I'm used to seeing presented in textbooks, with its own presentation for this age group. But this particular age group does have some special considerations that really justify its being treated this way. First, we want to take a look at the topic of parental abuse of adolescents. Much of what we see as physical abuse today, in the popular visions of the world, so to speak, seems to be more like discipline to a lot of people. Sometimes even still this is the case, even if it had been historically 20 or 30 years ago considered that way. Even still, as we've become more sensitive to the issue of physical abuse involving older children, there are still individuals within our system, both the child protection system and in the legal system, that view physical abuse of adolescents sometimes as appropriate discipline for parents. And this is an area that is a cause for concern for any individuals who are working with children in this particular area. And the types of maltreatment include all those kinds of maltreatment we've been studying this semester. Certainly, adolescents are not immune to any of these types of abuses. The fact that an adolescent is maltreated certainly has been shown to increase the risk of juvenile delinquency across all ages, both young and older. And so this is an area that's not only important for the adolescents involved as far as victims is concerned, but as we look at the larger society and think about the implications of the expenses incurred because of the fact that these young people have been mistreated so young and turn to all sorts of crime and delinquency later. The most frequent type of maltreatment involves neglect, and this includes medical neglect as well as other kinds of neglect as well. And also physical abuse is the next most frequent type of maltreatment of adolescents. When adolescents are maltreated, there's an increased risk of psychiatric disorders, including such diagnoses as depressions and all sorts of disruptive disorders, which would include conduct disorders and oppositional defiant disorders and those types of things, as well as drug abuse. Other factors that impact psychopathology in young adulthood include things like living in a lower socioeconomic status family, having delinquent friends, and having more physical punishment in adolescence than the typical adolescent. These are things that kind of amplify and increase the problems that any adolescent in particular would experience. And understanding things like how poverty impacts us and how our peers influence us certainly can explain that to you. The National Survey of Child and Adolescent Well-Being conducted a longitudinal study, and of the youth that were involved in that study, 620 of those youth had contact with the child protection system sometime 6 or 7 years prior to the time of the study. And those youth were then, as compared to the rest of the population in the study, were more depressed, had significantly lower academic scores, had a higher poverty rate, and were subject to more use of corporal punishment and those kinds of things. This really reflects the childhood experiences very closely, the results of this, in other words, so that kids that have been maltreated really do suffer a great deal more than and do more poorly in many areas of their lives. Girls' behavior tends to be more adversely affected by abuse than boys for some reason. And the risk factors for parent-to-adult maltreatment, which is by the way, is this table 6.5 in your text, really goes through this much more thoroughly than this. But some of the risk factors which kind of predict child parent adolescent maltreatment include things like a lack of parental warmth in the relationship, of course the presence of parent-child conflict, not having particularly good supervision, antisocial behavior among the parents themselves, those kinds of things. We look at sexual abuse of adolescents. The definition of caregiver to adolescent sexual abuse is something that really is, like all areas, is subject to some disagreement and some confusion. And yet the Violence Against Women Act did give a definition of caregiver to adolescent sexual abuse that included things, well, 4 different areas: sexual abuse, which would imply, and I don't want to refer to it as a sexual relationship because it's not a relationship, it's an abusive interaction, but it implies a sort of a seductiveness and kind of more of the molestation kind of types of behaviors on the part of the perpetrators. Sexual violence, which includes the use of force against adolescents. Sexual victimization, which in this definition is sort of those non-contact things like exposing the adolescent, or exposing oneself to the adolescent, or participating in voyeuristic activity with the adolescent. And sexual harassment, which would include inappropriate advances and comments and things like this by caregivers towards the adolescent. The relationship to the offender and the context of the abuse for sexually victimized female adolescents really varies from stranger to intimate relationship to authority relationships. So there really is a lot of different kinds of relationships that are between the adults and the adolescent that account for these instances of adolescent sexual abuse. For girls, it's of significance that girls attending parties are often the setting for sexual abuse by others. The United States has the highest teen pregnancy rate of any industrialized nation in the world. I think that's something most of us already know. And that's a particular problem because the children of younger mothers, there are all sorts of things that as they go through life that predict a much more difficult existence for them. And this is something that I'm sure is addressed in other classes that you've talked about that you've taken when you talk about adolescent pregnancy. There is really a need for greater attention to the adolescent victims of maltreatment. We do tend to believe that older children can cope with things more effectively and need less protection from the system, and that's simply not the case. What's important is that the interventions do be adapted to suit the age group of the victims, and this is something that will help increase the effectiveness of any kind of intervention that you do. But victimized adolescents oftentimes are, well, one person referred to them as being criminalized instead of treated. That we tend to blame the victim for whatever abuse has occurred, particularly those when it is outside of the family or by individuals. For instance, again, at parties and things like this, where the victim is often blamed for the abuse that occurs. Turning this around a little bit, when you have abusive adolescents, and we do run into some situations like this is not something that really falls under the child protection rubric when it comes to CPS workers, but this becomes more of a law enforcement concern, of course, in the family therapy concern by all means. And parent abuse could be described as any act perpetrated by the adolescent that inflicts injury on a parent, or any kind of threatening or controlling acts that are aimed at that parent. And this is interesting that 9 to 14% of all youth have abused a parent, according to at least one study. 9 to 14%. And those parents who are single and those parents who are parenting boys are more at risk to be abused. And there's all sorts of rationales that are tied to the adolescent parent abuse that includes things like, an abusive relationship between the child and the parent to begin with, that the parent had previously abused the adolescent, that there is low attachment between the two of them. Oftentimes the adolescent has witnessed interparental violence, And this is something that we'll be looking at, in another week or two in particular, as we begin to look at adult interpersonal violence in the families, that this is some of the impacts that witnessing abuse between parents or caregivers, some of the impacts that this can lead to. And also, long-standing abuse and dysfunction in the family is another factor that is tied to adolescent and parent abuse, particularly among adolescents who assault their mothers. Parricide is the word that is used when we're talking about killing parents. You may be more familiar with the term patricide, which involves killing father, or matricide for mother. Filiacide is the killing of one's own son or daughter, and fratricide or sibicide is killing a brother or a sister. And the text does take a look at this, where actually the abuse by adolescents of parents actually goes to the point where the young people actually kill their parents, and there are a small handful of cases of this very prominently around the United States from time to time. And in particular, there's a little bit of a time spent looking at matricide in particular, and they note that most of the mothers that are killed by children are killed by their adult sons. So this would be older adolescents, most likely. But those juvenile perpetrators who kill their mother include those who have been severely abused as adolescents, and they say that this is the only way they could end the abuse, or they have a severely mentally ill adolescent or a dangerously antisocial adolescent. So kind of not surprising, I think, this particular information. Sibling abuse is an area that we do very poorly with, and professionally speaking, I think. And as you go forward into your careers, I do hope that this is an area that you will give attention to. The system as it is set up currently tends to not focus much upon abuse by siblings, but really to keep the narrow focus, at least in child protection, upon the abuse of children by parents. And so, in fact, in this particular state at this time, because of the national registries that have been forming under the Adam Walsh Act, where you can there's a registry where you can research individuals' histories as perpetrators of physical or sexual abuse if they're looking to adopt or foster children. Because of that, there's been a lot of concerns about listing adolescents, younger people, as perpetrators in child protection cases when we do get referrals. And so what has happened in a lot of situations, at least that I've been seeing lately, is that instead of listing an adolescent as a perpetrator when a child has been harmed by an older adolescent, the perpetrator is being listed as an unknown perpetrator. And really we're looking more at the nature of the supervision by the parent of that episode. And certainly that's an area that's worth considering. Is the parent intervening appropriately and trying to redirect the adolescent, and trying and getting the kids into treatment if needs be, those kinds of things. But nonetheless, and this is something that is something of a theme here and there in this chapter, that adolescent perpetrators do need to be held accountable, because if that behavior is not treated properly, it's very possible, is perhaps even likely, that it will continue into adulthood. And so this is an area that I think, at least at this time, we're not dealing with appropriately. And the debate comes down to what is abusive and what is normal in interactions among children, and what does the difference in age have to be, for instance, between an older and a younger sibling, when an older sibling pounds on the younger sibling. Is this two brothers, kind of having a rough and tumble fight because they're unhappy with each other? Because you don't want to bring law enforcement into things that might be kind of normal interactions, right? You don't want to criminalize what might be more or less innocent disagreements among kids that don't know how to settle their disagreements differently. But by the same token, you don't want to ignore when there are elements of abuse, because the one sibling is much older or much larger or much more in a position of authority. And so this is some of the things that you have to sort through as you look at this particular interactions with in the families that you come into contact with. Things like competition between siblings and quarrels. And if you look in your adolescent development books, that's one of the areas where kids learn how to develop social skills. How do you children don't really learn about how to manage conflicts, for instance, in their interactions with their parents, because the parents are the authority. And so where children really learn how to manage conflicts is in their relationship with their peers, because that's where the negotiation goes on and the give and the take, that eventually develops into the skill that a child will have, or a young person will have, when he or she enters the real world as an adult. And so a certain amount of competition, a certain amount of disagreements and negotiations, however they occur, is something that's healthy for kids in their development. And so, again, we don't want to criminalize things that might be a part of that process, but if at the same time these things become too violent, or if there's aspects of control and harm, certainly in this kind of relationship, then they shouldn't be overlooked. And here's some qualities I think that might help you differentiate between abuse and non-abuse, and I rather like this list in the text, and there's a few other things that I've thought of too that from past experience. But first of all, is there a disparity in power? Is one child significantly more powerful than the others? And if that's the case, then it's not likely abuse. It is more likely to be abusive, I guess is what I'm trying to say. Not likely to be a mutual kind of a thing. Is how frequently do these incidents occur, and what is the duration of them when they do occur, is another thing you can use to kind of measure. I don't want to say how serious it is, but how to approach these particular issues. Is there pressure by one child on the other, or is there an insistence upon secrecy? Because when elements of secrecy or come into play in these incidents, that's when we have to be concerned that there are some abusive aspects to the relationship. Likewise, does the abuse occur because of pressure from the other child to do something different that the younger, smaller child is not agreeing to? What are the outcomes of the interactions? Is it sort of an ongoing kind of thing, or does one child come out on top and stay on top and continue to use and abuse that power? Is it developmentally appropriate? Is the behavior developmentally appropriate? If the parent becomes aware of it, does the parent intervene appropriately in the behavior? We were in a training workshop some years back for working with young child victims of sexual abuse, and I can remember a discussion about sexual abuse among children, and trying to decipher what is a behavior that should be considered abusive, that might, even with younger children, be referred to law enforcement for their involvement, as well as our own child protection involvement, this is kind of going back to some of the things that were earlier on this list, but the trainer said, what happens, and this is maybe part of the outcome of the interaction, what happens after the abuse? In this case, it was a sexual abuse we were talking about. And I'm not suggesting that sexual interactions among siblings is particularly normal and healthy, although there are some aspects of that we'll get to in a second, but particularly maybe with non-familial children. What happens after it occurs? Does the perpetrator, does the older child or the abuser continue to play with this child, or does the perpetrator leave and not interact more? If there's no relationship beyond the actual incident, it's very, very likely that you're looking at a very abusive interaction. Men tend to be more accepting of sibling violence more than women, and this, I think, kind of goes back to this idea that boys will be boys, and so we minimize concerns about any kind of violence that might occur in relationships especially involving younger boys. But victimization experiences of sibling violence, in other words, as an adult, of the adult in their own childhood, is associated with accepting sibling violence among the younger generation, but again, only for men. So if the dad, the male caretaker, had these kinds of interactions as kids, they're more likely to kind of just accept this. But statistics tell us that, and this is a theme I've heard many other times as well in other settings, that sibling abuse is far more prevalent than parent-child abuse, and that is something that might surprise you because it is overlooked, it is brushed aside, it isn't really dealt with, and the results of the sibling abuse sometimes can be just as severe. The Office of Juvenile Justice and Delinquency Prevention study indicated that about 8,000 8th and 11th graders being studied, 42% reported sibling violence, almost half. Is it benign and within the limits of normal play, or is it always harmful? Again, a question we have when we look at sibling sexual abuse. Inappropriate sexual behaviors between siblings range the full gambit of behaviors, from touching each other's genitals or touching one's genitals by somebody, another child, to oral contact and full genital penetration. But the most frequent type of sexual behaviors between siblings reported is genital fondling. Most experts think that sibling abuse is more common than father-daughter incest as well. And in one study of college graduates, 10 to 15% of the undergraduates reported some sexual contact with a sibling. That's 1 in 8 to 1 in 10, something like that. 29% in another group of college students that had opposite sex siblings reported having engaged in some sort of sexual activity with the sibling in a different study. So they're, again, not quite a third. Indicates some sexual contact with the sibling if they had an opposite sex sibling. The consequences of these behaviors, most often depression, anxiety, poor academic achievement, lower competence in peer relations. These are things that are not uncommon among victims of any type of abuse. And there are certainly spillover effects for the whole family as the behavior becomes known. And sometimes members of the family experience some secondary trauma because of dealing with the consequences of this behavior. And in other statistics, about 50% of the mothers of victims were incest victims themselves. There's been over the years a lot of blame placed on mothers for poor supervision or different kinds of things, for this, but we have kind of moved away from that, and mothers aren't responsible for everything that goes wrong in families. But there's still some aspects of our tendency to focus up on the mother's role. Sibling abusers in sexual abuse tend to have, for physical assaults by adolescents at least, increase with age, but sexual assaults decline. So that suggests that the older adolescent, the less it is likely that they're going to be engaging in sexual abuse with their siblings. And likewise, I think, to be victimized, as well as the older children become more aware of the fact that this behavior is not acceptable, and they become more assertive oftentimes in putting a stop to it. Males tend to be more aggressive in their abusive interactions, but the other gender prevalence data is very mixed in this area. And there are different explanations for psychological, physical, and sexual abuse on the part of siblings. Learning theories suggest that children have seen parent-child or experienced parent-child violence, or have seen interparental violence, and so this sets up an abusive relationship. They see it. They've learned how to interact with others and their siblings in particular from watching their parents. Feminist theory says it's the family structure and the authority that is vested strongly in men here, and the control that men have over their homes and things like this, and also our cultural acceptance of violence, that the two things put together really make it permissible for older siblings and male siblings to aggress against younger and female siblings. The power differential is very apparent in the age difference oftentimes. And finally, conflict theory, which really is very close to feminist theory in some respects, but has a broader perspective beyond gender issues and how those come into play. Conflict theorists believe that families resort to violence to resolve. There are certain families that just resolve conflict with violence, and among siblings, that siblings generally are competing for power or resources or better standing in the family. There are different kinds of treatments for juvenile sex offenders. Cognitive behavioral therapy is often, I think, the most effectively used in terms of individual treatment. A lot of, as we talked about with adult sex offenders, I believe, juvenile sex offenders, that relapse prevention model that is used with substance abusers is also the same kind of model that might be used in the treatment of juvenile sex offenders. The notion that there is a cycle of violence, a cycle of sexual abuse in this particular case, where the the offender sexualizes their anxieties, and this leads to them perpetrating on another individual. And it is a cycle, assault cycle model. And multi-systemic treatment also involves not only the individual, but works with the parents and the community and other significant individuals in the adolescent's life to help create the circumstances for a healthier adjustment and more positive interactions with others. Treatment for juvenile sex offenders does tend to reduce the recidivism rate, but there's still improvements needed. This is a particular area that's very difficult to treat. As a treatment person, when I was working in the mental health field, this particular population was a very challenging population to work with. But one of the things that I liked about working with the juvenile sex offender was that the areas that you cover in treatment was really pretty well defined and pretty well accepted. There were certain things you did in this, and this came first, and then this, and then that, so in a sense, there was kind of more of a script or map for successfully treating adolescent sex offenders. Same with adult sex offenders, but recidivism rate remains very high in all areas. Even though, again, it says with the juvenile sex offenders that they're perhaps a little more successful. Some female survivors need help seeing that they did not consent freely to the interaction with the perpetrator, and some male survivors need help seeing that they can be victims too. Male survivors of sibling abuse oftentimes have an extra amount of shame attached to it because of, again, the homosexual implications that come with that, and with the sexual behavior itself. Although I'm thinking of it generally involving a male perpetrator, and sometimes the perpetrator is female. But males, aren't supposed to be victims, particularly when it comes to sex. Our expectations in masculine socialization is we're always at the ready. Males are, and never turning down sex. And so, to be considered a victim of sexual assault as an adolescent male in particular, when identity is forming, is a very, very difficult thing for a male. Not to minimize the effects on female survivors, however. And the long-term effects for sibling physical and sexual abuse is kind of interesting. In one study, that more than half of the victims as adults had never married, and they're really looking well into adult years there. They'd never married, never established themselves in a permanent long-term sexual relationship with another person, and more than a third of the survivors as adults had distanced themselves from the abuser, really had almost no contact with him. And our responses as professionals and others that are connected to the victims in sibling abuse is something that is very important, and almost always the responses of adults are just not helpful. Boys are just being boys. It's bullying is something they do. If there was sex play between them, it was a mutual thing. It isn't that one person forced or cajoled or coerced another person into it. The abuse is the victim's fault. She was asking for it, or she has to prove that it really was something she didn't want to do, that type of thing. Or that the abuse isn't serious, and that's one of the things the perpetrators often do, is just deny that it was any big deal. And when the adults that are responding to this on behalf of adolescent victims have that kind of response too, that notion that I would just get over it and move on with things, that's not helpful at all. And likewise, the notion that it's a family matter that is a secret that shouldn't be betrayed outside the family system puts a lot of pressure on victims to set things aside, and sets up all sorts of psychological problems later in life. And sometimes even in therapy relationships, the topic is taboo, and therapists are uncomfortable talking about this professionals uncomfortable in talking about sexual abuse with the victims, and so there's sort of an agreement between the two of them, sometimes spoken, sometimes unspoken, that we just won't talk about it. What's a helpful response? Here it is. It is abuse. It wasn't your fault. Have you seen Good Will Hunting, the movie? I find all sorts of things in films that kind of reflect in materials in my class, and late in that film when Will finally has his breakthrough, I believe, about the abuse that he suffered. It was physical abuse that he suffered as a child at the hands of his, I believe, foster father, or maybe in his birth father, I don't remember, but that was the thing that the therapist said to him over and over. It wasn't your fault. It's not your fault. It's not your fault. And that's the thing that's very, very difficult for victims to accept and to hear, and it is something that's very important for them to come to recognize. Again, policy needs to look at how we deal with sibling abuse, and caseworkers in all areas, not just child protection. We all tend to kind of turn our eyes away from this and minimize the seriousness of sibling abuse, largely because the definitions are unclear. But as I mentioned to you, some of the people in child protective in the child protective world actually believe that sibling abuse isn't something that CPS workers even cover. And when caseworkers see sibling abuse, they may not recognize it. The authors believe that there's a variety of disciplines that really can be very effective in child protection, and they kind of lambaste the notion that the social work degree is the preferred degree for child protection. I may have some issues with that myself, having a social work degree, and here I am teaching a social work class. I can tell you that my own experience is that I believe the social work training prepares you best to work in child protection for a number of reasons that I'm not going to go into here. As a supervisor and as a fellow worker in child protection, after many years, this is a conclusion that I've reached, and it isn't social work snobbery or bias. It is based on my own experiences. That doesn't mean to say that individuals with other degrees, psychology, human services, and sociology and all those other areas, human development, can't be good child protection workers, because they certainly can be, and they have a lot of knowledge to bring into the field that actually social workers may not be bringing into the job. But above all, I believe that probably a social work degree is the best preparation for this job. The authors don't think so, but part of the reason for that is because social work training usually doesn't involve any kind of a focus upon abuse and that kind of training in class, and so this is an area I think that this course in particular, while it's being offered here as a special issues course, is not integrated into the course that I know of, at least in the long run, for the university. Inadequate training. There's an insufficient agreement about how to handle or define sibling abuse, and so the victims wind up suffering more long-term damage than is probably necessary. And even law enforcement, if perpetrators are juvenile offenders, they're less likely to be arrested than if perpetrators are adults. And here are some of the effects of family abuse on adolescent relationships. As you can see, none of these are particularly surprising to you. I mean, I'm sure that it's going to result in more antisocial behavior and violent interactions in their interpersonal relationships, both with their peers as well as in dating situations. And it is those children who experience polyvictimization that would be like neglect and sexual abuse and physical abuse, or any combination thereof, psychological abuse that involves those kids who have more types of victimization in their histories exhibit at the highest rates of aggression, delinquency, and interpersonal problems in later years.